Here we have another letter from a dentist. Title is, Being a Dentist is Slowly Killing Me. I've been out of dental school working for 3 years now. I have to say, dentistry is definitely not what I expected. We were taught in school to do everything in a meticulous, detailed fashion. We were taught the importance of doing things calmly, carefully, which is normal. I mean, we were practicing students. Nothing in dental school was to prepare us for what the real world actually entailed. Nor was it ever mentioned. I agree. Once I started working, I realised how controlled healthcare is by insurances. Most patients only want to do what the insurance covers, and unfortunately, the insurances don't have the patient's best interest in mind. The volume of patients is typically high, at least where I am, and essentially you're completing about 15 surgeries a day on patients that are awake. Yes, drilling into a tooth, extracting a tooth, doing a deep cleaning are all forms of surgeries. Smaller ones than an open heart surgery, obviously, but still meticulous surgeries that require attention to detail and full patient cooperation because they're awake. I have said this many times. Imagine performing meticulous surgeries on moving bodies on the furthest to back tooth in the mouth where you can hardly stick your fingers, knowing that if saliva touches the tooth, the dental filling material you're about to place may lose its properties and treatment success will become more reserved. That's not the bad part though. The bad part is it's normal for teeth to be sensitive after work. You just drilled into a tooth that has a nerve. True? But even after explaining this, some patients still have the tendency to think that you did something wrong and my tooth didn't hurt before you touched it. After you just tried your absolute best to stick an instrument all the way in the back of their mouth, trying to hold their tongue down, constantly reminding the patient not to close because saliva will touch the tooth, and trying to fix a cavity that you didn't place on that tooth in the first place. Now imagine doing that procedure on 5 consecutive patients, about 30 minutes per procedure. Nobody wants to be in the chair opening their mouth getting drilled into. Few are thankful for the detail that actually goes into accomplishing something such as a simple filling. I'm fortunate to say that I've built a following of patients that only want to see me. I won their trust and I'd love to keep on helping them, but there are too many people that just don't appreciate what we do and act like a-holes. We're in the modern era and materials used for crowns, fillings, etc. still have limitations. Materials can break, crowns can break, fillings can break, etc. As soon as something bad happens, the finger gets pointed at us ASAP. I'm shocked by the low percentage of people who actually take responsibility for the condition and want to throw their problem on us. For example, I just finished up on a patient who didn't have teeth for 15 years, which many times causes TMJ problems because there's no teeth, they're overclosing, all sorts, who had no replacement teeth and claiming that we were causing him to have TMJ pain because we took 4 visits in completing a set of dentures for him, even though it was an issue that began the first day a tooth was lost 15 years ago. Things like this are maddening to me. I try my best to think it's not me, it's them, but then it's so common, it takes a toll on you. Dentistry is probably one of the few careers where prices haven't gone up with inflation since almost the 90s. The amount of patients needing to be seen to meet overheads each year are rising. Insurances are trying to pay dentists less, causing dentists to have to see more patients to keep up with the rising material, rent, employee costs. Things aren't getting prettier on this side. And I've been thinking a lot about this lately, and I think I'm going to try switching careers to something people actually enjoy going to. I want to work somewhere where people are happily willing to go. This is an issue for American dentists, for UK dentists. This is just part and parcel of what we do. Unfortunately, the general public are incredibly ungrateful. And to be fair to a certain degree, it's not easy having something done right in the back of your mouth, having to open up as wide as possible. It does cause jaw pain, etc. But at a certain point, it's just part and parcel of what we do. It's our career. That's what we agreed to. That's what we got ourselves into. And at a certain point, you just have to accept it. There's not a huge amount that you can do about it, except to stay at one practice as long as possible and build a really loyal patient list of people that you like seeing, that like seeing you, and be really brutal about the ones that you don't like, that don't like seeing you. Refer them on, send them to a colleague, send them to another practice respectfully, give them options. Don't just drop them like that. I think part of our responsibility is that if we are not happy to see the patient, you have to refer them on to someone else who can help them. Some of the happiest dentists that I know are dentists who are working fully privately, and they've been really meticulous about building a patient list that are very, very loyal to them. Okay? So patients that they enjoy seeing and that enjoy seeing them. And imagine patients you're seeing 10 to 15 times a day, and the only patients that you see are patients that you like. That is the best case scenario. And if you're loyal to one practice, you find a really good practice that's private, and you can scale at, you can grow at, then your best option is to just become really strict about your patient list and cultivate it and grow it into a list that you're really proud of and that gives you minimal headache.